welcome back everybody to Co-Immunity Chronic Ills. I'm Maddie.
And I'm Kyle.
And today we'll be talking about healthcare and the costs of, being chronically ill and trying to survive. And we are talking to Jaren. Jaren, tell us a little bit about yourself.
Hi, my name is Jaren Byrd. I'm associated with a company called Fair Market Health. I have a couple roles with the company. I'm general counsel, but I'm also directing the initiative into mental health and behavioral health, which is near and dear to my heart from personal experience. But I also deal with chronic illness at a personal level. About 3 or 4 years ago, I was diagnosed with early onset Parkinson's, which fundamentally shifted my life.
Sure.
In some pretty negative ways to begin with, some pretty negative coping skills. And like a lot of people with chronic illness too, I knew something was wrong quite a while before I was diagnosed. I just couldn't figure out what the heck was wrong,
Sure.
which leads to being a little cuckoo for Cocoa Puffs, because you're just like, why can't I feel normal anymore? And what do I need to do that? So when I got to the diagnosis, it was life altering. It wasn't all that surprising. I knew something was fundamentally wrong. So it's been a long journey back to balance through that and negotiating some of what I think we're going to talk about today of, how do I find normalcy again? How do I find stability? How do I manage all this?
Sure.
And both from a traditional and non-traditional stance. So about the same time, I'm a lawyer by trade, and I was helping these guys with this little company called Fair Market Health, which was looking at transforming the way that individuals and businesses use healthcare, and differentiating between health insurance and health benefits and health care, which are two different things, but often get confused.
Sure.
And so my involvement with them kind of aligned with the time when I was making some pretty fundamental life shifts myself. And so I decided to transition into helping them. Fair Market Health is essentially a digital platform that serves as a marketplace or an interface between healthcare providers and those in need of healthcare, right? So whether it's a colonoscopy, significant surgical procedure, or in my sector, talk therapy, a behavioral health episode, inpatient, outpatient care, stuff like that. We feel that we can bring providers together with users and filter it down in a process using our digital platform where the right provider gets with the right person in need of care, and they can find providers. The other thing we love about it, which maybe touched on what we're talking about today a little bit, is who's directing the course of care, right? Who's managing this? Because, for instance, with my Parkinson's, and that's just one example, you go to a neurologist, you go to a primary care physician. The day I was diagnosed with Parkinson's is the day I got diagnosed or prescribed my first antidepressant, because there's such a high co-occurring deal. And who's in charge of all this and who's managing all this? And for a lot of people, just by default, it's their insurance provider.
Right.
Who said that 30 days is the right amount of time for an inpatient episode? Well, I mean, what kind of trauma is the person dealing with? What kind of co-occurring diagnoses are they dealing with? It's not treatment in healthcare isn't a one size fits all solution, but who's managing that? And so under our platform, one of the things we love about it is the professionals manage it.
Right.
When I call a lawyer, or a plumber, or an electrician, or go to an oncologist or whatever it is, whatever expert it is, I should probably listen to them,
Right.
and not some bean counter. So that's kind of where we're coming from.
Well, and such a frustration that we talk about is not only that the system is broken, but that the insurance, who has no medical experience, is the one deciding whether or not that treatment plan that your doctor came up with, is right for you. We a lot of times joke about, so like with my insurance plan, which I'm pretty lucky, I have amazing insurance, but even so, like there have been probably 2 times in my life that we've had to fight insurance on things, which is pretty amazing for how many diagnoses I have, but they'll call with like this insurance like nurse trying to like figure out like how they can save some costs. Like, well, have you so they called one time when I was on my way back home from Mayo and had, you know, seen all the best of the best. And she's like, well, you know, what are your main symptoms? And I'm like, well, I have like pretty severe arthritis right now and pain. And she's like, have you tried Advil and Tylenol? Yup. And that is why I'm on steroids and chemotherapy. Thank you for your call. And because the insurance does dictate, you know, it's such a double-edged sword. It makes it somewhat affordable, but also a lot of times you are fighting insurance to get that care that you need. And I love what you guys are doing because there's no middleman. Like, you know, direct to consumer is all the rage right now. And with you guys, you know, there is no insurance company that is needing to make money. Also, I don't think a lot of people realize how many insurance companies are for profit. And at the end of the day, they are trying to make their stock holders.
Yeah, I mean,
Money.
it's a myth perpetuated by whoever. I mean, probably by the insurance industry and insurance lobbyists. But when you know, Blue Cross, Blue Shield, Aetna, whatever provider you have, when the employee or the worker or the family member goes in and lays down that insurance card, who's paying that bill? I mean, they're not primarily, except for their copay and co-insurance bill. But a lot of people believe that that's Blue Cross Blue Shield paying for that. Or no,
Right.
no, they're for profit. They can't afford to pay everybody's medical bills. It's either your employer who's self-insured and paying that out of pocket, out of the bottom line of the company. So that's things that could be going to improvements in the workplace or wages to you.
Right.
That is going to insurance costs and administrative costs, or it's paid by the employee, by the individual receiving the services through premiums.
Right.
Yeah.
Premiums through these invisible costs. So it's not this benevolent company out of Omaha, Nebraska, paying everybody's medical bills for them. It's a for-profit endeavor. So part of what we're doing is educating people on the real cost of care and differentiating between health care and a health benefit from an employer to an employee
Sure.
versus health insurance. Because, and this gets to something that you just said about what your experience when you were coming home from Mayo, right?
Mhm.
The insurance company said no, and the nurse said take Advil. Well, people mistake that as healthcare advice. No, that's insurance saving money advice. That's managing cost advice.
Yeah.
That's known course of care from some wonk that you never met before.
Right.
Not the doctor you just met up at Mayo. And so that we're trying to differentiate between health insurance and actual health care. And health care needs to be, from your experience, it sounds like, needs to be holistic.
Oh,
It
100%.
needs to be no holds barred. It needs to be a throw the kitchen sink at it approach and be open-minded to any and all possibility, including trials and experimental methodologies, stuff that's outside the box that just doesn't usually fall within the cookie cutter insurance methodology.
Well, and you know, we host support groups, and a lot of people talk about, you know, here's where I'm at with treatment, and here's kind of the emotional impact of everything I'm going through. And so much of it is fighting with insurance. And, you know, for example, I just spent, instead of, you know, resting during my lunch and getting to enjoy, you know, eating with a little downtime, I spent 45 minutes today calling Humira, calling CVS, then calling Humira, then calling CV. I mean, I made 4 phone calls getting this coupon card for my Humira, so that even though I was on the phone with my insurance, they're telling me, I mean, it's just, not only do you have the financial stress when going about everything, but you also have the stress and the time that it eats up of, you know, managing all of the moving parts.
Yeah.
You just hit on so many things there that involved in the true management of chronic illness and chronic pain and stuff where there's no, it's not episodic, right? There's no particular end game in sight. There's just coping with the day and making tomorrow the best it can be.
Exactly.
And part of the road that we with chronic illness all have to endure is managing this in addition to whatever else is going on, because there are so many incidences of specifically stress-induced anxiety and depression.
Well, and suicide rates are 3 times higher.
Yeah, exactly. And anxiety about the fear of the unknown. Where am I going to come up with the money, and how much money am I going to need, and what care is going to be available, and will I have access to it? And depression when it's not working out.
Yeah.
And then that just exasperates things, right? It makes, going back to my example, stress and anxiety accentuate and exasperate my symptoms. And you see that across the board. It's not specific to Parkinson's, it's everything.
100%.
And then in addition to that, you have behavioral issues of when we live in stress and anxiety too long, and it's either undiagnosed or untreated, guess what we as humans do? We come up with negative coping mechanisms. That can be substance abuse, it can be self-harm, it can be all kinds of stuff. But a lot of it leads to isolation and shame, and further spiraling down into more shame and depression. And that not only does that lead to new things like substance abuse or things like that, but it usually disrupts your prescribed course of treatment too. You miss appointments. You can't keep your nutrition straight. You can't keep your pharmaceuticals straight. And so not only are you not treating the disease you have that you're dealing with, you're developing all brand new stuff.
Yeah. And sometimes even more diseases, I feel like, And like once you're diagnosed with one, I think, I forgot the statistic off the top of my head, but that you're more likely to,
for every autoimmune disease you're diagnosed with, it's either 30 or 50% chance that you'll get another one. And then that rises with each additional autoimmune disease that you get.
Yeah. And then the stress and anxiety and other mental health issues all increase along that same trajectory.
And people forget about, we talk about this downward spiral, and that's kind of the logic behind, everything we do at Coimmunity is once you're on that downward spiral, it's so easy to get to the bottom. And ultimately that bottom of the downward spiral is suicidal ideation. And how do you climb up? Or, even first acknowledge that you are on the downward spiral, because that's the first step, is you have to realize hey, looks like things aren't going well. And, those warning signs, because, so many times personally, since childhood, I've definitely struggled with suicidal ideation. And just from the stress and feeling like a burden and isolating myself, it's a lot to take in. And so many times, I couldn't even figure out that I was spiraling before I would get to that rock bottom. And so identifying it, but also then, finding ways to climb back up. I mentioned the suicide rate being higher, but also PTSD with people with chronic illness is higher than combat veterans. The statistics are just insane, and people forget about the mental. People on the outside of chronic illness forget about the mental health implications of chronic illness and the cost of it, because that's so much of it. We talk, to kids. A lot of people in our support groups are in college or, just out of college. And so many of them, when they're looking for a job, the first thing they look for is health benefits and what their health insurance is. Are they going to give me time off, or could I be fired because I have doctor's appointments during the week? Some employers offer therapy for free, or different services. Where do they sit on that health equation? And one thing I will say, kind of about this great resignation, is it seems like the employers that are putting people first instead of profit are coming out ahead. And so hopefully, the workplace and culture surrounding it will continue to evolve to benefit people with chronic illness. But in the meantime, we've got to figure out how to survive and try to thrive in the circumstances that we're in.
Yeah, there's so much interesting information coming to the forefront right now. And There was a movement towards integration of mental health and wellness with more traditional major medical prior to COVID, but COVID just really busted the ceiling on that as people realize isolation sucks, and I'm dealing with a lot of headspace that I didn't have time to deal with before all this downtime. But there's so many studies, right? Some of what you touched on was incentivizing employers to take a more holistic view towards health and the demand of their recruitment and employee base, and it's evolving. And we are seeing a big movement towards including mental health as part of the overall wellness and health picture. In chronic pain and illness specifically, I think it's an important part of the team approach to treating it, because if you, it's like, I always say with people in this field that, we kind of have an emotional, spiritual, and physical self. It's like 3 legs of a stool, and try sitting on a stool that's missing one of those legs, it doesn't work very well. Sure. Changing the light bulb's easy if you have that simple stool to stand on, but it's impossible with a broken stool. So you got to keep all those things healthy, and we're seeing that. There was this recent study in Utah where, as part of the employer's health package, included in medical treatment episodes, was included mental health, right? It was just included as part of the holistic team approach. And they saw an overall reduction in healthcare spend. They saw a 10-to-1 return on investment towards every mental health dollar spent on a per employee basis against their overall spend. 10-to-1 return on investment dollars invested. And that was a 10-year study. So it wasn't just a fly-by-night deal.
Sure.
And I think we're seeing that incorporated overall. And I'll tell you, here at Fair Market Health, as we approach employers, more than ever, at a surprising rate, what do you have in the mental health space? What do you have in the behavioral health space?
Yeah.
Over and over again, because and working with direct primary care physicians that have a little bit more flexibility than the people in the traditional system, are incorporating at a much higher rate mental health and behavioral health into their overall package, and referring people with showing up with chronic illness and chronic pain to those people early on, so that you don't start, this as from personal experiences, as do I, the further up the cyclone, the spiral cyclone that you start, the easier it is to get out of it, because it's really hard to climb your way out of that deep, dark hole when it gets deep and dark enough.
Sure. Yeah, and that's what that proactive healthcare is just so important, of keeping them out of the spiral, or just keeping them at the top. And I feel like, especially in the mental health sector, I feel like going to therapy or having those mental health resources can help identify a lot of those when you start to go down. And I think that's so important to have someone there to talk and kind of help you identify once you get into that cycle.
And the sense of community, I think the more I think when you start off getting diagnosed, you don't realize how many people are in the same boat as you. At least that was my experience. And as I've gone on social media and found people, or started support groups and things like that, you realize how many people are in the same boat. And I think when you find those people and you're able to say, hey, this is what I'm experiencing, and then the other person says, hey, I've been there too, here's what worked for me, or there's an accountability side of things, and they can kind of hold you accountable in ways that people that don't get it can't. And also just knowing that you're not crazy, and this is real, and this is hard, and embracing kind of that side of things. I think before I struggled a lot before I started Coimmunity. I was very, very depressed. I was in college, so you're not technically an alcoholic yet, but definitely drinking more than I should have been drinking, things like that. What?
Little self-medication.
It was just so hard. And, before I went off to college, well, I guess I didn't go off to college because the week the week I graduated from high school, the college I was supposed to attend, I had this great scholarship, everything worked out, had met with accommodations. The college I was supposed to go to told me that they couldn't work with my medication, that it was too much of a liability. And so I ended up staying home for college. And so I had watched all my friends go away to school. I was really sick my freshman year of college. I couldn't walk for about the first 2 months very well. I couldn't drive. I couldn't work. I was really, really sick. And so, social media can be a positive thing. Social media can be a negative thing. But, I didn't know anybody else that had chronic illness. And, that isolation, I think, just really weighs on you. But if you can find a way to get involved and kind of surround yourself with at least one person, that has a chronic illness, I think it can show you that there's hope.
Yeah.
It's one of those things. If you don't got it, you don't get it.
Right.
Yeah.
And to an extent, whether that can be addiction, that can be chronic illness, that can be cancer. If you don't got it, you don't get it. You don't know the secret handshake to the club of that particular misery.
Right.
Right. And we all have this deep desire to belong and to just be heard and understood. And even those who love us and invest in us or care about us can't necessarily understand where we're coming from. And they want us to be better. They just don't know how to help. And they help sometimes in ways that can be destructive.
Sure.
Take some Advil. Thanks. Never thought of that.
Yeah.
All better. The alcohol, stop drinking. Thanks. Never thought of that. You need to, and that causes shame in and of itself. And that leads to isolation, which leads to destruction and going down that downward spiral. You hit on one of the most important factors, not the only factor, but one of the most important factors, which is community, community of people who get it. And fortunately, now's the best time to need community in the history of the world, right? We have more opportunities for community than any generation before us has ever had. And we need to take advantage of that, especially those of us dealing with chronic illness and pain, because for several reasons. First of all, just for the healing capacity and support capacity of being heard and understood, right? And realizing I'm not the only one thinking this. I'm not as crazy as I thought I was. Maybe still. But also to the point of controlling your costs and controlling your course of treatment, stuff like that. Those are full of new ideas, right? It's collaborative thought. It's hive mind stuff where I may be in a chat room with somebody that, has people that are 5 or 6 or 7 or more years down the road in the progression of this illness than I am, and have gone through things that either I'm going through now or will go through, and have some treatment ideas. Maybe have seen some resistance to novel or experimental treatment like that. Maybe we're getting pushback from the insurance company now on, and say, hey, I tried this, I tried that. Just, brainstorming.
No, and I think that's, a great kind of tip of there are a lot of free resources. As we know, chronic illness is expensive, but there's a lot of, free community. You need, if it's online, social media, these chat rooms, support organizations, community free, is free. And that's kind of one of those biggest things that we don't want to, add a cost burden to people that need the support.
Well, and we had a guest last week, Carmen, who she went to pick up a prescription and she found out how much it was going to cost with her copay, and she didn't realize that there was a coupon program for her medication. And the pharmacist helped her, and I was like, yeah, most medications that are name brand, you can find a coupon code. Like when you're talking to your community, you can find, especially type 1 diabetes, there are tons of programs to help you get cost lowered for, your equipment, your insulin medications. And, same with my narcolepsy medication is $15,000 a month, but we pay $5 because of a coupon program. Or free incentives in other ways, and working with insurance, fighting with insurance, getting your doctor to advocate for you. So much of that, I think it is important to learn from people that have been at it longer than you.
Yeah,
and then give back.
Yeah, and I guess going back to what you said there, like fighting with insurance, that's one thing that I really like about fair market health, is that you have that upfront cost. This is what it's going to cost. I know what it's going to be at the end of the day. So if it's planning for it, saving up, like I know this cost. And I think that's a really big thing with, sometimes you go to insurance, like for my sleep studies this last year, I thought my insurance was going to cover it, and they call me, maybe a week before I was supposed to go. I already had it scheduled, planned on, because I had to drive to St. Louis to do it because of my insurance and everything. And they call me and they're like, oh, well, it's going to be $500 for this one, but then you hit your deductible, so then this one's only going to be $200. And it's like, well, I mean, it's kind of at that point of, I need this done. It's a week away. I already planned on going, I have all my trip arranged already. It's like, I guess, I'm like, what am I supposed to do at this point? I'm like, I guess, and I just had to kind of pay it. And that's one of those things that having that upfront, like, okay, I know it's going to be this. If I can't pay for it now, let's save up. And I know what that cost is. And I think that's very helpful with eliminating some of that stress.
Especially when a lot of us have high deductible health plans in the chronic illness world.
Yeah, man, if you want to talk about that stuff, we can talk about that stuff for hours. I got example after example after example of that stuff.
Yeah.
Personally, through the different levels of care I've gotten, you get bills like up to a year or more sometimes after this and that. And I thought we were done with that. I'm still getting bills for it.
Yeah.
I'm still getting hit with it. And then that stuff happens. But the other thing about it is that you touched on is, even if you are insured, or for those with insurance, you have high deductibles, which you got to meet, which are designed not to be met, by the way, because if you hit your deductible and go into it, well, guess what happens? Premiums go up, either at an individual level or a corporate level.
Right.
But the sneaky thing is not the deductible, because at least you know what it is. It's that co-insurance on the back end. The highest reason for personal bankruptcy in the United States is medical expenses, and most of those people are insured. That 20% copay at the back end doesn't sound that big, because you're like, heck, it's only 20%, they cover 80%. But if you have a $100,000 medical procedure, a lot of people don't have $20,000 sitting in the bank.
Right.
To cover that. The cool thing about what we're doing is, and companies like this are doing, finding providers, facilities, and bundling them together in a cost savings program, so that what might be a $50,000 procedure ends up being a $30,000 procedure with the same doctor.
Mm-hmm.
Well, at a $20,000 savings between those two, for example, guess what the employer can choose to do with that money? Waive your deductible, waive your co-insurance, and still save money off the bottom line of their healthcare expense. And you get the procedure. So it's kind of a win-win scenario.
100%.
And you touched on it earlier, in a tough recruiting atmosphere where people are more involved in their healthcare management at a personal level and invested in it, take more ownership over it, and health benefits are of paramount importance in recruiting. It's a good tool for employers to have.
Sure.
Yeah, 100%.
One thing I do, I think people don't realize, and I do want to mention, that's slightly off topic, but not really, is I never realized you could negotiate with hospitals. Like, that was never something I realized you could, like, they're gonna either write, if you don't pay it, they're either gonna write it off, or you could say, hey, here's what I can pay every month, and they're gonna say most of the time, okay, sounds good. Like, you can work with billing departments at hospitals, or if you have that high deductible, you can always ask, okay, what would the cost be if I didn't use insurance? Like, those are options. And I don't think people
negotiate.
Mm-hmm.
Yeah, and that's tough for some people to do, because you feel like it's David against Goliath, right? But they're more used to it than you think. And if you're within that system, don't be afraid to say, you know, what will you take today? Or how many payments will you break this up into? Just like the don't take no for an answer. Don't necessarily take first shot at the billing, at the billing structure as gospel either.
Right.
Go to bat for yourself.
100%.
Yeah, and I think that comes back to, always goes back to, these are things that people can help you with, getting tips on how to negotiate, what have they gotten done.
We like the buddy system.
Yeah, but it's just, I think it's very hard, and we kind of touched this on in the last podcast about just having somebody who will help advocate for you, because it is so hard with chronic illness. There's sometimes that you are just very fatigued or exhausted, and making 4 calls, it's not, sometimes it's just a brain tired of, you call one person, oh no, you need to go talk to this person, they call you back, then you have to go back and forth, and it can get very exhausting. And I think having somebody that, in your life, or, even in a support group or something, that'll help you, like, okay, this is what you need to help talk with, or, how can I help you, with calling people, whatever it may be, just having somebody to help you get through those.
I agree, you guys, that's so key. Whether it's a friend or family or somebody you find in a support group, to help motivate you to be who you can be. I agree. And to help you along, we all need to help up once in a while, right?
Sure.
Whether you're in chronic illness or any part of life.
Yeah.
But the other thing I think is important for me in dealing with my chronic illness too is knowing the fact that I'm going to have good days and bad days, and not only good days and bad days, but good days and bad weeks sometimes,
Sure.
right? Where you're just down and you don't have anything in the tank, and that don't necessarily have the expertise.
Mhm.
And for people with chronic illness, they may be dealing with a talk therapist, a psychiatrist who can prescribe. In my case, a primary care physician, a neurologist, whatever your specialists are on your deal. And then there's just not much communication between those people. You're the hub, right? And one thing I've found personally, and we advocate here, is a good relationship with a direct primary care physician is a good model. Especially I would suggest it to people with chronic illness and pain, because they can be a champions, and they're outside the system, right? They're not bound to the insurance structure system. And so they can be they tend, in my experience, to be a little bit more creative, a little bit less constrained in what they do. They can go to bat for you.
And save you money.
They can go to bat for you and save you money too, because you're basically, let's just say it, we with chronic pain and illness use medical services a little more than the average person. So when you're talking about a subscription service, there's those who don't use it at all and those who use it a lot. And you get more value if you're the one that uses it a lot.
Yeah.
So we're pegging the value meter.
Right.
With the EPC relationship.
So we both use a direct primary care doctor, kind of as our team captains also. Explain that a little bit for people that don't know what direct primary care is.
Direct primary care is a general practice, usually primary care physician, the one you go to with your flu symptoms and your sore throat, can take care of most stuff that doesn't need referral. Some of them do internal lab work, or imaging, stuff like that. Some don't. It's usually a subscription model where you pay $80, $100, it depends on the physician, per month to have access. And it's usually a concierge level access compared to your general primary care physician experience through the insurance paradigm. You get better access, I find, usually telehealth options, phone options, quicker turnaround on visits. They can refer you out anywhere.
Yeah.
But in the chronic illness and pain category too, you use the word advocate. They can advocate for you to get you into that trial at Mayo, to get you into this experimental stuff, to maybe be a champion with you if you are a lot of people that use DBC still have traditional insurance, health insurance. This is just an addition, a layer in addition to advocate for you with the insurance wonks about why you might need a specific treatment that might be outside of their normal guidelines.
And I mean, they have such fewer patients that they have the time to advocate for you.
Yeah. Whereas, you usually go in and you might get 5 minutes of doctor time. You go in and get 30 minutes, 45 minutes, an hour. I have personally found it to be a value purchase in my life.
Well,
and given the growth curve of physicians moving that way and patients utilizing medical services that way, I think it's a paradigm that's really caught on. It's working, right? It's working in a broken system.
And I would say, I mean, when I first heard about it, I thought, oh, well, you hear about concierge doctors and just how expensive they are, being $5,000, $10,000, $15,000. And I didn't, this could be something. We are in Wichita, which is a little cheaper, but I think doing your research and seeing the expense in the long run, I didn't realize how cheap it could be, being just out of college, starting a company, all that, I didn't think that would be something I could afford. And it, it ended up being something that I could afford. And just, I feel like I saved, like the one or two of my first appointments, I felt like I got more accomplished than I did with my other doctor in the 3 years that, in college while I was seeing somebody. He'd come in, say something for 5, maybe 10 minutes, and then he'd go, and then I'd be like, well, is this right? And then, if you wanted to go back, everything else. So I feel like having those longer appointments allows you just to talk through everything you have and get it all done in one shot instead of doing something and then going back in a month and then going back in a month,
Well, and I've used one for about 5 years now. And my breaking point with because I have a primary care doctor here in Wichita, and then the rest of my doctors are at Mayo. Well, Mayo would ask for lab work, and I would have to call the nurse, and then the nurse would want me to get an appointment with my primary care doctor. And then my primary care doctor half the time would forget about the labs. And then you have to wait for the labs. And then she wanted to review the labs in an appointment. And I'm like, right, I have a job. Whereas now I text my doctor and I'm like, hey, my Mayo wants these labs. I go in, I get the labs done, and then he emails me the results and he's like, let me know if you have any questions. Or this week I woke up and I knew I had a kidney infection. So I texted my doctor. He's familiar with my case and he called out the prescription. I didn't even have to go in. And I have traditional insurance also, and we hit our deductible in January every year. But for people that don't hit their deductibles in January, we have a $10,000 deductible. I'm just that cool that we hit it every January. But for people that don't always hit their deductibles and have traditional copays, a direct primary care doctor might have $100 subscription fee every month. And I think like for me to get labs, it's like $5. For me to get medications from them, it's typically $3. Whereas in the traditional model, my copay for one doctor's appointment was $80. And, I see the doctor every month most of the time. And so I think when you look at it, it does save you money.
Yeah, to touch on some of the stuff you guys just said, both of you, the concierge experience well, first of all, it's just preferable from a consumer experience standpoint, right? But it's surprisingly affordable in a lot of ways, considering how much time you're getting to the doctor, how much you can get accomplished in the same amount of time, how many visits to the doctor under the traditional insurance model would it take you to accumulate 45 minutes with a FaceTime with a doctor? You'd be 20 appointments or something like that. But also, to your point about Mayo, right? One of the beautiful things about Mayo is how much you can get accomplished and how seamless it is, right? So you're meeting with a neurologist and they're like, well, I think you should also talk to a rheumatologist and a radiologist. Well, you're talking to them like within the hour.
Oh, my doctor
Right.
calls them.
You
In the
just
appointment,
change-
he
you
calls
might
them.
walk down- Yeah, you might just walk down the hall and you're there, and it's seamless. It's not 6 weeks, then 6 weeks, then 6 weeks.
100%.
And that's the beauty of Mayo, is how much you can accomplish with I mean, true stellar people in the field so quickly. And to a lesser extent, that's what you're getting with the concierge experience, right? You're getting, you need lab work, done.
Mhm.
You need imaging, done.
Yeah.
You need to see me in another week, done. I mean, and that's kind of that same, let's just get it done approach, rather than try and fight through 5 different specialists in five different areas over the next 8 to 10 weeks, where you're trying to get this schedule, and circle back and say, well, what the hell did we even accomplish?
Well, and that's more time that you can spend at school, at work. I mean,
Yeah.
it's so much less disruptive to your life, which then further eliminates stress and creates better patient outcomes. So people a lot of times, because I talk about Mayo quite a bit, and actually surprisingly, like quite a few people in support groups go to Mayo, but I'll have people ask me like, well, is it Mayo Clinic so expensive? Do they even take insurance? Mayo takes insurance, and like I always give this story. So I normally, like back when I was getting diagnosed, it took me 2 years for Mayo to diagnose me, and I would be there for a week at a time. And you know, I would see 7 specialists. I would have imaging. I would have scopes. I would have all of these different tests. Like one time, I had a joint scan, like a radioactive joint scan. Those things. My entire 7 days of all of that at Mayo Clinic was cheaper than my 30-minute ER visit where they gave me a breathing treatment. And I think the reason they are able to control costs is because of how effective and efficient they are at getting things done. And so the more you can, whether or not you're inside, you know, a system like Mayo, and there are other systems that are similar in the way they work, but you know, with that direct primary care doctor, being able to just get things done saves so much money.
Yeah.
Well, and that direct primary care doctor, whether it's a DPC or not, whoever it is, you need that hub, right? You need to be like, well, I was prescribed this over here and that over there, and suggested to take this supplement over here, and like somebody needs to be monitoring that and the interaction between it all.
Oh, 100%. We normally like to close this out with a segment we like to call
Just the tips.
So
I was not forewarned about the just for tips
well,
section, but I will roll.
Yeah.
We are 23 and 21, so it's fitting. What are your 5 tips for navigating chronic illness and saving money?
5 tips for navigating
Or however many.
chronic illness and saving money.
Or anything you want.
Well, one is, so I mean, we're gonna summarize a few things that we talked about already.
Yeah.
Don't isolate, engage and utilize community.
Yep.
Be humble and willing, because be willing to seek and accept help. Willing to try things outside of your comfort zone. Willing to be vulnerable, willingness to be vulnerable. And then willingness to give back when it's your turn, when you have a little experience, strength, and hope to share with people. Don't take no for an answer. Be an advocate for yourself, because insurance is built around an appeal process, right? And often you can get results that initially you couldn't if you just bear down on them a little bit. And that goes for what we talked about with the billing as far as cost savings goes. Don't take the first bill as the final offer necessarily. Use DPCs if you are at all dissatisfied with your experience with primary care at the moment. Consider DPCs. It's surprisingly affordable and surprisingly effective as far as a modality of managing.
If you can't afford it, find that primary care doctor that
that
Will champion.
Yeah, exactly. Interview, shop. Remember, you're a customer and a provider. You're not tied to any one person. Trying to think if there's anything else. I don't know how many that was. I was kind of shotgunning
Oh,
you
it's-
there.
There,
It doesn't
there
have
were
to
there
be
were
fun.
quite a few in
Yeah,
the
and if you're at all, this is a hidden expense of chronic illness, right? That we talked about, both from a quality of life standpoint and a bottom line dollar standpoint, but the mental health aspect and behavioral aspect, manage that. Whether it circles back around to something as simple as involving yourself on an online community and voice, or getting talk therapy. I mean, most insurance plans cover talk therapy now to some extent. It's not a very widely discussed benefit. A lot of people have employee benefit programs, employee assistance programs rather, that offer some free mental health care. It's not necessarily the best program, but it's something available, especially if you're having really negative or thoughts leaning towards self-harm and stuff like that. But manage that healthcare, because untreated mental health problems are not going to get better. They're not going to get better. They're either going to manifest themselves from a low quality of life through negative coping mechanisms like substance abuse, because we can only tolerate so much pain up here before we have to alleviate it. And it's usually going to cost more in the end. Not to mention, whatever you're dealing with from a chronic pain and illness standpoint, it's going to aggravate that, make it worse, and make that experience worse than it has to be.
and compliance saves you money.
Yeah.
Compliance saves you money.
Take your meds.
Exactly. Back in my days in full-time legal practice, I used to tell people on the front end, is like, they would ask, do we have to spend money on this right now? I was like, no, you can spend it now, or we can spend a lot more in a few years when this all goes south. And it's kind of the same thing with our health, right? Invest now, the dividends are paid later, and if you don't, the costs get greater.
Yeah.
Emergency rooms and hospitalizations are a lot more expensive.
Yeah.
Exactly. We're speaking the same language there.
Well, thank you so much for coming on to Thank you so much for coming to chat with us.
Yeah, I like that. It's kind of a hybrid word. I love it.
Yeah.
We're into bundling here at Farm Market Health. You're bundling vocabulary.
There we go. Perfect. All right. Well, we will talk to you later, and we appreciate you coming on here.
Thanks, guys. Have a good day.
Cheers.